Welcome to this edition of the First Aid Show. In this film, we asked a paramedic, what are chest compressions and how do you deliver them?
So if you recognise that the patient that you're with, the person that you're with, is seriously ill, they will be a strange colour, they may have complained of chest pain, and they also are no longer breathing, you will start to do chest compressions. On the telephone, when you've called 999, they will instruct you how to give chest compressions, and they will count so that you do it in the right time. It is so important to have a go, and I promise you in that situation the adrenaline will be running through your bloodstream and you will be able to deliver chest compressions. It's incredible how many times I've arrived on scene and people are delivering chest compressions to a loved one and they're doing a fantastic job in what must be a highly emotional event for them. Some tips that I could give you about chest compressions. First of all, make sure the patient is on a hard surface, ideally on the floor. You pull them off the sofa, off the bed, make sure you've got good space, and then you kneel at the side of their chest, right up close. And then the next tip I would give you is you're going to put one hand on top of the other and you're using the heel of your hand in the centre of the chest, usually between the nipples, and you're going to lock your elbows. And you're leaning up and over the body and you're delivering good, strong chest compressions to the centre of the chest. When you deliver chest compressions, there are a few things that make all the difference and make sure it's effective. You're trying to build up pressure within the system to get all of the blood up to perfuse the main organs, particularly the brain. So it's really important that when you do a chest compression, you push down hard, but you also allow for what we call recoil. You come up off the chest so that it can rise and fall effectively. The other thing that's really important is that you just keep continuing to deliver chest compressions. Don't stop and tie your hair back or wipe your nose, just keep going. If you are tiring and becoming fatigued, it's really important to call somebody else into the room at the scene to come and take over from you. In that event, we advise that you count down 5, 4, 3, 2, 1, and the other person is on the other side of the chest and they immediately take over chest compressions. There are lots of songs that people might be aware of that help you keep a time, but as I said, the person on the telephone, at control, will be counting for you and making sure that you give a good time. But some typical songs are Nelly the Elephant, Staying Alive, and quite commonly, particularly with young children, we've often used Baby Shark to keep the timing of simulating. You're simulating the heartbeat, you're doing the heartbeat for the patient and keeping that brain perfused with oxygen. A lot of people worry that they should be doing mouth to mouth. That is something that has now gone out. It's not encouraged anymore because it was stopping people from attempting to do chest compressions, and chest compressions are the most vital thing that you can do. So please don't worry, you don't need to do mouth to mouth, you don't need to count, you just need to do a continuous cycle of good, strong chest compressions.